Hi, welcome to Checking In with Amy. My name is Amy Goldberg, and I'm a registered nurse with Neighborhood PACE. PACE stands for Program of All-Inclusive Care for the Elderly, that being 55 years of age and older. We service the areas of East Boston, Chelsea, Revere, Winthrop, and Everett, Malden, Medford, Melrose, Stoneham, and Boston's North End. And the goal of Neighborhood PACE is to keep an elder living at home in a safe, active manner. Today, my guest, and I'm going to read this so I don't get it wrong, is Tina Gianellis, who is a pharmacy intern. She attends the Massachusetts College of Pharmacy in Worcester, Mass., and is in her final year of pharmacy school, which is 8 years long. She'll be graduating this May with her Doctor of Pharmacy degree. Prior to attending pharmacy school, she earned her bachelor's degree in chemistry with a biochemistry concentration at Salem State. Well, that's a lot.
Yeah.
You've been busy. Yeah.
Very, very busy.
So welcome to Checking In with Amy.
Thank you so much for having me.
My pleasure.
Very
So
happy.
let's get right to it. So tell me, what is chronic kidney disease?
So chronic kidney disease occurs when your kidneys are damaged and there's a progressive decline of function with them. And it gets worse over time. It could happen over months, even years. And there's about five different stages to chronic kidney disease, and that's based on severity. So stage 1 would be the least severe, and then stage 5 is the most severe.
And what we're going to do is talk about, first of all, how common is this chronic kidney disease?
It's actually very common. Last year in 2017, it was estimated that there's about 30 million adults, or 15% of the United States population, that have chronic kidney disease. And there are millions of other people who are at increased risk for it. So it's very common.
And what causes it?
There's so many causes to it. The first leading cause to chronic kidney disease is diabetes. The second leading cause is high blood pressure. So it's very important to maintain proper control of your blood sugar and your blood pressure, because doing so can prevent chronic kidney disease, and it can delay the progression to end-stage renal disease. Other less common causes of chronic kidney disease are autoimmune diseases such as lupus, inherited disorders such as polycystic kidney disease, and that's essentially when it's what causes your kidneys to have cysts, to grow cysts in them. And additionally, there's people who have recurrent kidney infections that can cause it, along with other conditions that can block your urinary tract for a long period of time. For example, urinary tract infections, kidney stones, or an enlarged prostate. Even hepatitis B and C can cause chronic kidney disease, but that's very not common at all.
So I think the main thing with that is, if you have high blood pressure or diabetes, you've got to know that you have these diseases. So a lot of times people don't go to the doctor, so they don't know these things. Mm-hmm. And so I want to just stress here how important it is for people to see their doctors, to check on all of this, to make sure that they don't have any of this.
Absolutely.
And these issues going on. So now it gets a little bit more technical, but let's go into what the role of the kidneys are. What exactly do they do?
So I think that's a very good idea, Amy. The kidneys do so much. As you can see on your slide, the kidneys are responsible for 2 major functions: to filter and to collect. If you look at your screen, to the left is a picture of one kidney, and to the right you see somewhat of this yellow squiggly line. This squiggly line is what you would call the nephron, and this nephron, it's pretty much the filter that does it all. A little interesting fact is we have about 1 to 2 million nephrons, tiny filters in each kidney. So that's a lot.
That's a lot.
And on the picture, you can't even see it really. You would think it's this big unit, but it's really tiny, and it's 1 to 2 million in the kidney. So what they do is they remove toxins and waste product from our body. They also remove excess fluid to balance the fluid in our body. On top of that, the kidneys release many hormones that affect different conditions. For example, one hormone controls blood pressure and another stimulates red blood cell production. If they're not making enough red blood cells, then you become anemic, which is when your blood has a low amount of healthy red blood cells. Kidneys produce the active form of vitamin D, and they control calcium metabolism. Without being able to do this, we wouldn't be able to promote strong, healthy bones. So as you can see, they're involved tremendously with our health, and if they are not working properly, waste and water will accumulate in your body, and then we'll start to feel sick, and other health conditions may arise. So it's, and this is because the kidneys are no longer able to maintain our health. So they do a lot.
They do
Yeah.
an awful lot. And now this is funny because when you ask a patient, well, where's the pain? Many times people are not aware as to where their kidneys are located. So let's talk a little bit about that.
That's a really good question. So kidneys are a set of bean-shaped organs that sit on each side of the spine, below the ribs and behind the belly. They kind of look like the kidney beans that you buy at the store. What do you think, Amy?
Yeah, I know. You make a kidney bean dip, it's all good.
Maybe that's how they got their name.
I know.
Basically, you can see that they are about the size of a large fist, and all of our blood gets filtered through them multiple times per day. The kidneys can filter about a half a cup of blood per minute and can hold about 22% of your actual blood supply.
And let's talk a little bit about how the kidneys work and the role, so forth.
Sure. So it's really amazing if you think about it. We'll refer to the blood that comes into our kidneys as the dirty blood because that blood has waste product and we want to filter it. If you look on your screen, I have highlighted the renal artery where the dirty blood enters the kidney. As the kidney separates the clean blood from the dirty blood, the clean blood that contains the nutrients, and that's what we want, that's what our body wants, it gets collected in a separate area. The clean blood goes into our renal veins. The renal vein takes the clean blood filled with nutrients and sends it back into our body. Any waste products or whatever is not needed gets separated from the clean blood and goes into the ureter. And then the waste that goes into our ureter, it's eventually what pours into our bladder and becomes our urine. So this is how we eliminate the unwanted, the bad waste or toxins that our body does not want by urinating it out of our system. But to make things simple, Amy, I compared our kidney to a coffee filter. So a coffee filter separates brewed coffee from the coffee grounds, just like our kidneys separate the waste product from our blood. Now, in chronic kidney disease, this is an accumulation of waste product in our body. So you can think of this as the coffee filter not working, and we end up with coffee grains in our brewed coffee. And we don't want that, do we?
No. And it makes us unhealthy,
Yes,
basically.
yes.
Let's talk now about symptoms of chronic kidney disease.
Sure. In early chronic kidney disease, people find it actually asymptomatic. So some people don't even realize that anything's wrong because what happens is the amount of nephrons, we just actually talked about it, the amount of nephrons that we have in each kidney, we had mentioned earlier how there's about 1 to 2 million tiny filters in each kidney. So even if you had 40% of your kidney working, you might not notice any symptoms at all. When kidneys start to shut down, the body has a hard time keeping its balance with everything. Symptoms may begin to arise when your kidneys are really damaged and chronic kidney disease has advanced to a more severe stage. But a few symptoms some people may experience are itchiness, muscle cramps, nausea and vomiting, not having much of an appetite, you may not feel hungry, you may not notice some swelling around your feet and ankles. Some people may feel like they are either urinating too much or too little. Another symptom is having a hard time catching your breath and trouble sleeping. So there's a lot of symptoms with that, and that's towards the later advanced stage of chronic kidney disease.
And so those are some of the symptoms. So if you go to your doctor and you're telling your doctor about this, your concerns, what would the doctor do to check to see if you have this disease?
It is so easy to check, for your kidney function. It's very important to go see your doctor, especially if you feel like you're having those symptoms. If you happen to experience any of these symptoms or you haven't had a checkup in a while and you're curious to see how well your kidneys are working, you should definitely go see your doctor because it's very simple and very easy for them to check your kidney function. All they need is a few simple tests, really. So there's the urine sample that we need, and what we do is we look for blood or protein in your urine. If they see these, this could be a sign that your kidneys aren't working properly or as well as they should. Another test that we need your blood test. We need a sample of your blood, and what they do is they look to see if there are high levels of a particular muscle waste called creatinine. So once they know how much waste is in your blood, they can estimate how much blood your kidneys can filter. And this is called the estimated glomerular filtration rate, or GFR. To make things simple, you can think of the GFR as a percentage of kidney function. So if your GFR is about 50, then you can think of your overall kidney function being about 50% of what it should be if it was working properly. It's important to remember that the GFR is just an estimate, and your GFR does fluctuate on a daily basis.
So that gives people you get back your blood work and your urine, and this would be something you could even learn a little bit about.
It's very easy.
So let's talk next about what could be some risk factors.
Well, we know that diabetes is the #1 cause of chronic kidney disease, and we know that high blood pressure is the second leading cause of chronic kidney disease. So if you have those, you're definitely at a higher risk for chronic kidney disease. You are also at increased risk if you have a history of heart problems or stroke, if you're obese, if you have a family history of chronic kidney disease, if you smoke cigarettes, and if you are greater than or equal to 60 years old.
Oh, well, the aging will continue.
Fortunately.
The other things, we could keep an eye on. The high blood pressure, the obesity, and things like that. You can try really hard.
Absolutely.
So those are risk factors. So one thing that I know about is I know of someone that only has one kidney. So let's talk a little bit about that.
Absolutely. People are living with one kidney. There's so many of them out there, and sometimes it's perfectly okay. It's kind of scary thinking about it because you think of kidneys, they come in pairs, but some people are born with just one. There's some people that are born with two and only one is working. Some people even donate their kidneys for other people. So it's perfectly fine. It's just, your blood's going to be filtered at a slower pace.
And you said how many
normal.
nephrons are in each kidney?
Yeah, about 1 to 2 million.
So we still have that going for us.
Yes.
Yeah. So that's a good thing to know. So going to have your doctorate of pharmacy. What medications are harmful for kidneys? It's good to know that.
Oh yes, definitely. Believe it or not, there's a lot, and most of them are actually over-the-counter products. So that's what's kind of everyone should be aware of it. So most of these medications, as I said, they are listed over the counter. That's why it's very important to always make sure it's okay to take an over-the-counter medication with your doctor or pharmacist. Just because they're available at many retail stores does not necessarily mean it's okay for you to take. The drugs that should be used with caution in chronic kidney disease are non-steroidal anti-inflammatory drugs, or NSAIDs. I have listed here Advil, ibuprofen, which is ibuprofen, Aleve, and aspirin. I also have listed here is Celebrex, which is it's a prescription drug, but I want to specify that baby aspirin, if you're taking baby aspirin, which is 81 milligram to 162 milligram daily, that's perfectly fine. This is just for a higher dose aspirin, but mostly ibuprofen, naproxen. And then also certain antibiotics are harmful, especially if they're taken at a high dose or you're on it for a longer time. Just make sure to take it as directed by your provider. Certain medications that treat diabetes or blood pressure, even diuretics, and this is harmful if you're dehydrated, so it's very important to stay hydrated. And then also long-term use of medication used to treat heartburn, reflux, or stomach acid. This is Prilosec, Nexium, Prevacid. These are actually available over the counter. So it's just the long-term use. That's what should be cautioned.
And so what do you mean by long-term use? Because I've used those type of medications, so I just need to know that.
Yeah, absolutely. So for omeprazole, they typically say not to exceed 8 weeks, but some people require to be on it for a longer time. So for example, if you have erosive esophagitis, then that's okay, omeprazole, as long as you're being, your doctor is monitoring you appropriately, that should be fine. But usually they say 8 weeks.
Okay, so that's good to know.
Yeah, yep.
And how can we know what it is, we know what causes it, but how can we prevent chronic kidney disease. That would be really an important thing to come away with.
Very important. There are many things we can do to maintain our kidneys' health. One is to avoid medications that we just spoke about. Also, we know by now that controlling blood pressure and blood sugar levels are crucial. It's important to check your blood sugar often if you have diabetes and to stay adherent with your blood pressure medication. If you're a smoker, the best thing you could do is try your best to quit. Not only can smoking affect medications used to treat high blood pressure, but it can slow blood flow to your kidneys, making chronic kidney disease even worse. Alcohol and salt intake should be limited. Diets high in sodium increase blood pressure levels. It's best to look for foods that have no more than 6 to 10% of the daily sodium value. Also, if you're overweight, try your best to, exercise daily and try to lose some weight. It's recommended to exercise or stay active at least 30 minutes per day and have regular checkups and be alert with your body. If you're experiencing symptoms, just contact your doctor and schedule that appointment.
That's very important to say.
Very important.
I know. And then we know how the doctor's role fits into this, but all these years in pharmacy school, that there's a reason that that the pharmacist should also get involved in this. So tell me what the pharmacist's role is in all of this.
Absolutely, we do so many different things just to ensure safety and make sure that the medication is appropriate for the patient. Safety, that's the number one, patient safety. So based on, do you remember the labs that we spoke about before with the blood and the urine? And doctors calculate the GFR, the glomerular filtration rate. So we take that information, we take the lab information, we can also calculate the glomerular filtration rate. And once we are able to know your kidney function and how much, like what percentage it's at and what severity level it is at, we're able to assess look at the medication profile, make sure that everything looks appropriate. We're able to adjust the doses based on patient-specific kidney function, improve the treatment, recommend appropriate alternatives to medication, and to educate the patients, family members, even providers or healthcare workers if they have any questions regarding a particular medication that could potentially cause harm to the kidneys.
So I thank you for all this valuable information, and I wish you all the very best in your coming years.
Thank you so much, Amy.
Doctor of pharmacy.
Such an honor being here. Thank you.
It's my pleasure.
Thank you.
So again, if you or anyone you know could use some help from Neighborhood PACE, please feel free to call us at 617-568-6377. And until we meet again, please be well. Bye now.